Have you ever needed a medical procedure or service, but your doctor required prior authorization from your insurance carrier before? A prior authorization, also known as a pre-authorization, is an approval your doctor needs to obtain from Medicare or from your Medicare Advantage plan before he or she can perform a medical procedure or test. Since Medicare only covers medically necessary services, obtaining this approval also assures your doctor that he or she will get paid for the service that they perform for you. And that's what prior authorizations are all about. So how does this affect you? In this video, I'll explain what you need to know about Medicare and prior authorizations. No matter if you have original Medicare and the Medigap plan or a Medicare Advantage plan, your doctor may be required to obtain a prior authorization before performing a service or prescribing a particular medication. This authorization is required by the party who will eventually pay for the medical service. So typically, we see prior authorization requirements come into play for the more costly procedures like PET scans, surgeries, or for expensive medical supplies and durable medical equipment. Your healthcare provider files the prior authorization paperwork and directly communicates with your insurance carrier. You typically will not handle any of the paperwork. However, if you need an urgent procedure, you will want to make certain that your doctor files the paperwork as soon as possible, as you may not be covered without that approval. It typically takes from 5 to 10 business days to hear back on whether your insurance carrier approved or denied the authorization request. If approved, you are good to go and can move forward with the planned procedure or prescription. And if denied, you can appeal that decision or discuss other options with your healthcare provider. If you are a Boomer Benefits client and have coverage through us, we can assist you with appeals. You can simply call our client service team and our team will further investigate why the service was denied, and if warranted, we'll help you to resubmit. You might be thinking, how will a prior authorization affect me? Or does that mean my surgery won't be covered if my plan doesn't think that it's necessary? If your healthcare provider does not correctly code your service bill or file necessary prior authorizations on why you need this procedure, your plan will likely not provide coverage. And many doctors have concerns about all these prior authorizations. According to a CFO report by Becker's Hospital Review in 2021, the American Medical Association surveyed 1,000 practicing physicians and found that 94% stated the prior authorization process delays patients' access to necessary care, and 90% said prior authorizations have a negative effect on patients' clinical outcomes. Nonetheless, prior authorizations aren't likely to go away anytime soon. So you can expect that whether a medical service will be approved by your insurer will ultimately come down to the question of necessity. Is your procedure or service clearly medically necessary under Medicare's standards? If so, you may not need a prior authorization. Is there any gray area on whether Medicare or a Medicare Advantage insurance company would question the medical necessity? Then you'll likely need a prior authorization. It is important for me to also mention that prior authorizations are generally not necessary during an emergency. Procedures during an emergency will often be viewed as medically and immediately necessary. Let's look at prior authorization in relation to Medicare supplements versus Medicare Advantage plans. The Social Security Act didn't require any form of prior authorization for Medicare services in the past. However, the law was altered to allow prior authorizations for specific services and items such as durable medical equipment. And we see these prior authorization requirements come into play more frequently with Medicare Advantage plans than with original Medicare and Medigap. Although original Medicare is allowed to conduct prior authorizations, we usually see them in only a few circumstances. Medicare Part A rarely requires prior authorization as an inpatient. However, if you must have prior authorization, your physician would obtain the needed forms and then go and submit them to Medicare. Medicare Part B services may require prior authorization whenever you are administered a specific drug in an outpatient facility. Some medications require your physician to submit a drug prior authorization form, which your physician would complete and then provide. Once the form is approved, Medicare will provide its share of the coverage. When you stick with original Medicare Part A and B, you also won't have a network of providers, so you can visit any provider that accepts Medicare, and a referral is not needed to see a specialist. Original Medicare will pay for your approved medical services, and if you have a Medigap plan alongside your Medicare, it will always pay its share when Medicare approves your claim and pays its share first. Prior authorizations for services offered by Medicare Advantage plans are much more common, and therefore has been some media coverage about this in recent years. In fact, the American Hospital Association urged CMS in late 2021 to address prior authorization issues affecting Medicare Advantage patients and proposed regulations to streamline the process and limit all the delays to care. Think about it. When you enroll in a Medicare Advantage plan, you are signing your original Medicare benefits to be provided to you by a network of providers contracted with a private insurance company, which is in business to make money. One of the ways in which insurance companies make money is by making sure that care is medically necessary before that care is performed. In fact, according to the Kaiser Family Foundation, at least 70% of Medicare Advantage plan enrollees have to get prior authorization for things like durable medical equipment, skilled nursing facilities, Part B drugs, and inpatient hospital stays. Generally, higher cost services will require prior approval by your Advantage plan. If an authorization is denied, enrollees do have the option, though, to appeal the plan's decision. But unfortunately, many people don't appeal, and then they're left paying the full cost. Providers are aware of this too. Becker's Hospital Review CFO report stated that 79% of the physicians surveyed said that prior authorization sometimes leads to abandonment of treatment. Since each Medicare Advantage plan has a provider network, many enrollees will need prior authorization to see an out-of-network provider or specialist too, or to get to a non-emergency hospital. Each plan has different requirements for services with prior authorization. So if you are a Boomer Benefits client and you run into a prior authorization issue, you can just give us a call for assistance. With permission and names changed, we have collected a real-world example from our client who needed prior authorization in the past. Barbara needed neck surgery, which required prior authorization before the surgery could be performed. The prior authorization request had been submitted to the Advantage plan by the surgeon, but it was denied. The client tried to work with the surgeon's office and the member services for her plan to get this corrected, but she had no luck handling this on her own. Barbara then called our client service team and connected with one of our representatives who contacted the plan and found out that our client had not met their requirements for the surgery to be considered medically necessary. We then worked with the surgeon's office on the client's behalf and explained the reason for the denial. Our team kept in close contact with the office to make sure the appeal was filed promptly, and a week later, the surgery had been approved and the client was able to move forward. Unfortunately, very few Medicare beneficiaries will take advantage of that appeal process because it's such a pain to figure out all on their own. 85% of the physicians in the Becker's Hospital report said a high burden was associated with prior authorization, and we would agree. So just be aware that Medicare Advantage plans can require pre-authorization for both hospital and medical services, and also for certain medications on their drug formularies. Each Part D prescription drug plan has a formulary which is a list of the drugs covered by the plan. The plan can place restrictions on certain medications, and prior authorization is one of those restrictions. If a doctor wishes to prescribe this medication, then the doctor's office will need to work with the plan to get the drug approved for the enrollee. The plan will then contact you and they will let you know if the request has been approved, denied, or if more information is required. If the request is denied, then the Part D plan will not cover the drug. Plans use prior authorization to review your drugs and check for potentially dangerous interactions, that your doctor may not have been aware of if he or she doesn't know all of the medications that you're taking. This prior authorization restriction also prevents you from getting prescribed an unnecessary medication, one that can be addictive or is expensive when other similar medications would be less costly. When a Part D plan reviews the prior authorization request, they may recommend a generic or alternative drug that may work just as well in treating a medical condition. When you sign up for a new Part D drug plan, review your plan documents and the drug formulary to see if any medications you are taking will have this requirement. You can have your doctor's office then start the process immediately. Most plans will have an online form that you can print or take to your doctor's office for the completion if he or she doesn't already have the form on file. Once you receive the plan's decision, you or your doctor can ask for a review of the decision if you're unhappy with the result. If you are a client of ours, we of course can assist you in that entire process. The prior authorization process is designed to reduce the cost for both the insurance company and the enrollees. Plans will also have this requirement to limit access to certain services that have experienced fraud, including durable medical equipment and home health care. But prior authorization can create hurdles for beneficiaries and their doctors, ultimately delaying the treatment or forcing them to abandon it altogether. There are positive and negative aspects to the prior authorization process. The process can be frustrating for Medicare beneficiaries as it happens behind the scenes between the insurance companies and the providers. It is a waiting game once the doctor submits the necessary forms, and this request can take weeks before a decision is made, all the while you're needing a procedure or medication. Understanding what is involved in the Medicare's prior authorization process and having the Boomer Benefits client service team on your side will make the entire process a little less daunting. Watch this video next on the 12 reasons why you will love our client service team.